with that, I'll pass it off to Joan Chang to talk about Medi-Cal Share of Cost.
Hello, everyone. My name is Joan Chang. I use she, her pronouns. I'm an attorney here at Community Legal Aid SoCal. We serve all of Orange County and a sliver of Southeast LA County. But I know some of y'all are from counties outside of Orange County. So, the information we're going to talk about applies to all counties. These are the Medi-Cal rules that apply statewide. But some of the numbers that I'll providing with our contact information again would be limited to OC residents and assisting OC residents. Though you can call us and then we could probably, type in your zip to be able to send you over to perhaps another legal aid that serves your area. Okay, so let's dive in, folks. We're going to talk about Medi-Cal Share of Cost. We're going to talk about what the heck it is, how that's different from other types of Medi-Cal, how to calculate it. But the point of today is just to know that this even exists. Okay, you're not going to be expected to do the math and learn everything that the slides that I'm going to present to you include, but just know that share of cost potentially exists and you potentially want to be screened for it with your Medi-Cal County office. Okay, let me do this here. Okay, because I would love to see folks' beautiful faces. All right, can y'all see this? It says Medi-Cal Share of Cost. Community Legal Aid SoCal. Yay, I love the thumbs up. Thank you. And if y'all have attended one of my prior presentations, I'm a fan of, let's use the pen. Can you guys see this red line underneath? Yes, okay, wonderful. Okay, we're gonna do an introduction into our office and then dive into the fun topic of the world of Share of Cost Medi-Cal. Okay, let's talk about us. This is our mission statement. I'm not going to read it out loud to you, but I like to brag about this. This is our mural on the back of our Santa Ana parking lot. Not a lot of folks get to see it because a lot of the times we're assisting folks over the phone. And so I kind of like to brag about it and show it off because not a lot of folks get to see this beautiful artwork that we have. Our service area, like I said, we serve Orange County residents and a sliver of Southeast LA County. We have physical offices in the starred cities here. This is our different units. So today I am in the health unit. We're going to be talking about, again, Medi-Cal and share of cost. But we do have other units or departments within Community Legal Aid SoCal. And I'm just highlighting them, but we have a lot to go through. So I'm going to just kind of go through this. But if you have any other legal needs and you're an Orange County resident and perhaps falls within these categories, please feel free to give us a call. If we're not able to help for one reason or another, at a bare minimum, you'll at least get a referral to potentially another agency or another nonprofit who may be able to help you. We do have there are eligibility requirements. Again, we have to have residents who are in Orange County and Southeast LA County. For health unit services, let me go back here. Health and seniors, we do not have an income or an asset cap or property cap. So for these other services, if you are over income or over asset, you may not be eligible for our office's services. But for health unit services and senior unit services, and seniors is considered 60 plus, we will still ask about your income and your property and your assets, but doesn't matter how little or as much as you have. If you've qualified for our services for the other requirements, you're good to go. But these are some of the eligibility requirements for our other services, non-health, non-senior. Just to kind of highlight, we do not assist with criminal law matters. The only kind of quasi-criminal matters we handle are expungement cases. So if you have yourself or a family member who's looking to clear the criminal record of or being able to expunge certain types of things from your record, we do have an expungement clinic. Okay, but other than that, though, we're dealing with civil stuff. We're not dealing with the criminal stuff. Okay, we do have legal workshops and clinics. I'm not going to go through this. You guys will have a recording of this in the slides. But we do have a lot of workshops and clinics. So it's not necessarily, like well, it still can be. It could be done in like a one-on-one setting, but in like a larger classroom setting. But we do have these workshops and clinics in these different areas. Okay, let's kind of dive into what the health unit specifically does. I'm going to skip this. Who we serve, everyone. In terms of ages, my youngest client, I guess you could say in utero client, I had, pregnant person clients, making sure that they get access to prenatal care. And I think my oldest client was 101. So, we assist folks at all different age levels. Um, you can be healthy, and just asking for, what sort of health insurance programs that you might be eligible for, to those who have chronic or chronic conditions. So, we do have service a large spectrum of folks. Okay, so these are kind of like the key words here, where we assist those with Medi-Cal, Medicare, what we call duals. Those are those who have both. We do assist with covered California issues, dental. Sometimes our clients forget that we do, health. Health does include dental care and vision care as well. So sometimes we have clients who get into kind of sticky situations with a dental office where the dental office signs them up for a dental credit card. There are very specific legal protections on when a dental office can sign you up for a credit card to pay for your dental services. So we're just making sure that dentist's office are following the law. We also assist with IHSS and home supportive services and private insurance plans as well. So it could be an employer-sponsored plan or a health insurance plan you purchase off exchange, which means basically like you're buying it directly from Anthem or buying it directly from Blue Shield instead of going through Covered California. Okay, I like to think of these as our buckets. So we have kind of buckets of areas that we assist with. We're talking about eligibility. Eligibility is when you're applying for a particular program. So whether or not you applied and got denied, or you got terminated from, and that includes from programs like Medi-Cal, Medicare, and Covered California. But once you have the coverage, say you got approved for Medi-Cal, say you got approved for, or that you're enrolled into Medicare, access to care, access to your benefits. Have you been experiencing delays in your care? Are there adequate network of doctors? If you have a particular rare condition and your HMO doesn't have, a specialist that actually treats your rare condition, how do you get access to those sort of doctors and specialists? Those are kind of the things that we can help with. We also do represent at hearings. So there are such things as Medi-Cal hearings, Medicare hearings, and IHSS hearings. So with those appeal hearings, if there's enough evidence for us to represent, we can do so. Medical billing, this also includes dental bills. Sometimes my clients sending me a bill and saying, hey, I got this bill. I'm not sure if I'm being billed the proper amount. So sometimes we're reviewing the bill, making sure insurance paid what they were supposed to pay, and you're getting billed the amount that you're supposed to be billed. I like to proudly talk about us being the Medicare Medi-Cal Ombuds Program service provider. So if you are considered what we call a dual eligible, that means you have both Medicare and both Medi-Cal, or you're eligible for both. You can call our office for assistance. We also are part of the Department of Managed Healthcare, DMHC Consumer Assistance CAP program. So there are particular health plans in California that are regulated by DMHC. And if you need assistance with filing an appeal or just need more information about it, we could assist you there. And I like to brag about this. We're a proud member of the Health Consumer Alliance. It's other legal aids in other counties up and down the state. So things that are happening in Orange County might be happening also in San Francisco County or in Central California. We regularly meet and kind of share notes and see if there's any sort of advocacy we could do, not only at the county level, but at the state level. Okay. Some of our wins, we've assisted thousands of folks in making sure they get Medi-Cal or stay on Medi-Cal. We've assisted hundreds of folks navigating between Medi-Cal and Covered California, because that process is supposed to be easy and seamless, And it's not. In practice, it gets really messy when you get bounced between Clever California and Medi-Cal. And so sometimes we have to get involved to make sure folks are getting coverage. Sometimes between the two, sometimes folks get terminated from both and they just don't have any access to care. So we try to assist in making sure that transition is smooth. Some past wins, some durable medical equipment wins. In the last couple of years, I've won my client a power wheelchair when initially their health plan said, hey, you don't really need this chair, when in fact they actually did. And they had lots of doctor reports and medical evidence to say that they needed the power wheelchair. This was a win a couple of years ago for a minor child who was nonverbal, whose speech therapist had recommended like a iPad-like device that would help them be able to communicate with their family members and with their teachers and classmates. The insurance company said, no, you don't really need this, when in fact it was really well documented as to the client's need for it. So we were able to get them that iPad-like device for them. I had represented a client at a Medi-Cal hearing when initially CalOptima, the Medi-Cal plan here in Orange County, said, hey, that lung tumor removal surgery, there's other types of treatment that you can get instead of this surgery. We were able to get not only the doctor to testify at the hearing, but a lot of medical reports to say, no, this is the only option for this particular client. And so we were able to get the judge to approve the life-saving lung surgery. Sometimes our clients get improperly illegally billed with medical billing and dental billing. We've saved our clients lots and lots of money, and making sure that doesn't happen to folks. And thousands or hundreds of outreach presentations just like the one that we're doing today. Okay, I know I threw a lot of information at y'all, but I just want you to know that we are a lifeline for y'all to reach out to if you, again, live in Orange County or an Orange County resident. If not, I'm gonna do my best to include at the end of the chat the Health Consumer Alliance. If you live in another county, I can connect you to a other legal aid, basically the same thing that we do, but in other counties. Okay. All right. I'm going to dive into the topic today. Before we talk about share of cost Medi-Cal, let's talk about the difference between what we call Magi Medi-Cal and non-Magi Medi-Cal. Okay. I know we use a lot of acronyms here in health. It's kind of a lot, but I'm going to break down each of these acronyms and what they stand for. Okay. I'm going to kind of break it down here between two different types. I mean, there are thousands of types of Medi-Cal programs and aid codes, but if we're just kind of simplifying it here, we're talking about Magi and non-Magi. I know some folks, sometimes we have health enrollment assisters and HICAP folks that appear at our trainings here. So y'all may be familiar with these terms, but for those who are not, I want to make sure we kind of provide a foundational knowledge. So MAGI. MAGI stands for Modified Adjusted Gross Income. So MAGI, basically, the general rule is if it's taxable by the IRS, most likely it's going to be considered countable income for Medi-Cal purposes. And they call it modified simply because there's actually Medi-Cal rules that specifically say certain types of income are not counted. So they call it modified adjusted gross income. So generally, Magi will be looking at tax rules. I hope y'all can read that. Can you guys read that? Tax rules? Okay, I'll do my best. I'm doing it on my mouse here. Okay. Magi typically will be this category of folks. So those who are 19 to 64. But essentially for those who don't have Medicare yet. No Medicare. So we're looking at Magi. Today we're talking about non-Magi with share of cost, but I just want y'all to know the difference. Essentially, the folks on the left-hand side are Magi folks. It's going to be those who are 19 to 64 and who do not have Medicare, okay? On the right side, we call this right side of the folks non-Magi. non-Magi. So we're not looking at tax rules. We're looking at different types of rules. Non-Magi folks generally are folks who have Medicare or who we call are age, blind, and disabled. And we're going to talk about what that A, B, D. And we're going to talk about that. So these are for folks who have Medicare. There are special rules. The difference between Magi and non-Magi, the main difference is with non-Magi, we're going to be looking at property and assets. All right, so I don't know if y'all are aware, but as of January 1st, 28 days ago, the state kind of changed their minds and reinstated the asset test. So now for non-Magi Medi-Cal, Medi-Cal can now start to inquire about what sort of assets that you have. So that includes how much you have in a checking account, bank account, a CD account, investment accounts, if you own property outside of your residence, things that are considered assets or property. In Magi, they're not looking at property. They're only looking at income. For non-Magi, they're looking at income and assets. Okay? Because we used to not have the asset test because we got rid of it for about 2-ish years, but now it's back. So we need to now deal with it again. We're not going to be talking so much about assets today. We're going to be talking about share of cost income. So let's kind of dive further. Okay, I'm going to skip that. Okay, the umbrella. There's an umbrella. I'm a visual learner. I like to think of things like as an umbrella. So the big umbrella is the non-Magi Medi-Cal programs. Under that is called age, blind, and disabled. I like to call this free Medi-Cal. It also includes age, blind, and disabled medically needy, which is what we typically call share of cost Medi-Cal. And then there's other programs I'm not going to go into because I could spend, an hour on each of these topics, but there's many, many more non-Magi programs. But today we're going to be talking about the medically needy, age blind, and disabled share of cost program. Okay, let's dive in. All right, so there are 4 math steps that goes into calculating how much your share of costs will be. Again, you're not going to be expected to know this. I am terrible at math. I didn't go to law school to do math, but I do math every day for my job. I still count with my fingers, but I use a calculator every day. You are not expected to do this math, but I'm showing you examples on technically this is how the math works in the Medi-Cal world so that y'all kind of get familiar with it, but you're not expected to know this and memorize it. Just know that share of cost does exist, and I'm going to explain to you how it works too. Okay, so we're going to talk about age, blind, and disabled. A is aged, so that means you're 65 and older. So the reason why that's important is because typically if you've paid into the Medicare system, and you have enough Medicare work credits, that's when you're eligible for Medicare. Blind, we're not talking about, like the DMV or your, optometrist just filling out a form that says you're blind. It's a legal definition defined by Social Security as to what that definition of blind is. So just keep that in mind. It's defined and actually determined by either Social Security or there's like a state agency called the Disability Determination Services that also can make that decision and that determination for you. Disabled. Again, disabled is a legal term of art. So you have to be deemed disabled by either Social Security or by the state's DDS program. This is not just a disabled placard. If you are eligible for a DMV disabled placard, does not mean that you are, quote, disabled under the eyes of Medi-Cal, under the eyes of Social Security. So we have to make sure we make that separate and clear. Okay, age, blind, and disabled. All right. Let's look at the income limits. I'm talking about 2025 because we're only a month into 2026, but suffice it to say, it technically hasn't, the application of the 2026 numbers haven't been applied yet. That happens in April. But these are the 2025 income limits for Medi-Cal that are currently in place until April 1 of this year. So I'm going to skip this part, but 2025. So for one person, if you are not married, your income limit is this per month, $1,800 for free Medi-Cal. Free Medi-Cal, not share of cost, because the beautiful thing is for share of cost, there technically isn't an income limit. If you are married or in a registered domestic partnership, this is your income limit for free Medi-Cal. It's pretty low, just keep that in mind, but there's certain things, certain deductions that you get, and we're going to talk about that. So this is the same thing for one person, for two people. And every year, this percentage, these dollars go up by a couple of bucks. So like I said, I think it's going up in April. It's 18, I forgot what it is, but it's going up 18 something. Okay. So step one, you're going to deduct $20. What's great about Medi-Cal is they give you this free $20 deduction. So if you have any sort of income, they're going to automatically subtract 20 bucks from your income. So that includes Social Security, your pension money, anything, you're going to just get $20 off the top, which is great. They're not going to count 20 bucks. If you have earned income, so if you're working, they deduct $65 and then they divided it by 2. So let's look, we're going to look at this in a minute and how it works in terms of numbers. But say, for example, you may be, quote, retired and receiving Social Security retirement, but, you may want to still be working part-time or maybe just like, a side hobby that you still love to do. I had clients who love making jewelry and sold it to family and friends, or sometimes would go to like jewelry bazaars and would sell their jewelry, just for a couple of $100 per month. But, it was still some income for them that they just enjoyed doing. So any sort of work that you're doing, that could be a part-time gig, you deduct, you get to subtract $65 and divided it by 2. Step 3 is you get to subtract any health insurance premiums. Okay, so we're talking about Part B premiums. So Part B, I think right now, what is it? I wrote it down. It's $202.90 per month for Part B. So you get to deduct this because this is not money you're taking home. This gets taken out of your Social Security check each month. So that's not money in your pocket. So you get to deduct this amount for your Medicare Part B. Sometimes if you have like an Advantage plan that, like, say, for example, you have like Humana, but it's a PPO plan. Sometimes the PPO plan might require you to pay a little bit more on top. I've had clients pay anywhere from like 20 to like $200 per month more. So that's the amount of money that you can take away out of your countable income for Medi-Cal. So again, that's not money in your pocket. So we want to make sure Medi-Cal doesn't count the money that you actually don't have. It also includes Part D. So if you have original Medicare with Part D, some of my clients are paying extra, like $30 a month, $50 a month. Those $30, $50 get deducted from your countable income. Okay, and again, we're talking about the income. These are for free Medi-Cal. For free Medi-Cal, not share of cost. But let's talk about step 4 and what share of cost is. Okay. And then this is for 2 people. Whoops, for 2 people. If you are at this amount or less, so what is this? You do less than or equal to, I've already forgotten my algebra symbols here. Less than or equal to. If you're less than or equal to these amounts, then you're eligible for free Medi-Cal without a share of cost. No share of cost. All right, so you got to do step 1, step 2, step 3. We're going to look at an actual example, so it's helpful for y'all to look at the numbers. Okay, if you are over this amount, we're looking at share of cost territory. All right, so if you are over these amounts, greater than, then we're looking at share of cost. Okay, so let's look at it. Okay, so we're talking about share of cost. This is step 4. Step 3 were all these things in red. Step 4 is this. Step 4 is you get to deduct what they call a maintenance need allowance or level based on the number of dependent family members that you have. So this includes your spouse. This includes any minor children you might have. This actually might also include adult dependent children. I had a 70-year-old client who had a disabled adult daughter who was like in her 40s. Who they were financially and physically still caring for, and the daughter was still living with them. So we were able to count the daughter in their maintenance need level amounts. And you also include yourself. So yourself. So this is the chart as to how much you get to deduct for how many of these people. So say, for example, it's you and your spouse. It's this. So say, for example, it's you plus you have 2 minor children, then this is how much you're going to be deducting. Okay, so let's look at this in numbers. I know all of this, this might have just flown through by your heads. Let's look at the numbers and we'll break it down. Okay, y'all? Bear with me, stay with me here. Okay, let's look at an actual math example. Okay, so let's talk about Senora Garcia. All right, Senora Garcia, she gets 1,000 bucks in Social Security retirement. This is assuming, again, I'm just kind of making assumptions in this example or hypo. The $1,000 is after her Part B is already deducted. So, you know, the 200 and what is it, $2.90. This is after that's already been taken out. Okay, she also is married, and her spouse, Senor Garcia, receives $1,250 per month in Social Security. And on top of that, Senora Garcia actually is working part-time as an Uber driver, and she's earning about 500 bucks per month. Okay, so this is just a pretty real life example. I probably have had Senora Garcia several times in the last couple of years. Okay, in this scenario, both spouses are applying for Medi-Cal because both would like coverage. And so we're going to look at eligibility for both Senor Garcia and Senora Garcia. All right, so let's do the math here. Step 1, you always get the $20 free off the top. So we're counting Senora Garcia's Social Security, adding Senor Garcia's Social Security, and then you get to deduct 20 bucks. So this is the total amount for unearned income. So this is step 1. Step 2, because she has that Uber earnings, you don't just, Medi-Cal doesn't just take her $500 dollar for dollar face value. The great thing is you get to subtract 65 and divide it by 2. So all Medi-Cal's looking at of her 500 bucks from her Uber driving is actually this amount. So this is the only countable income that they're looking at for her Uber money. Okay. Let's break this down. Let's see this one. Oh yeah, step 3 is to deduct any health insurance. We assume that these amounts were already after the Part B premiums were taken out, you know, the 202 and 90 cents per month. We're assuming that this was already taken out with these amounts. Okay, so total countable income. So when a Medi-Cal office is looking at how much income Senor and Senora Garcia have, they're looking at this. This is what we get at. This amount technically is over the income limit for free Medi-Cal, right? So this is our income for 2 people. This is technically over to this. So we have to move on to step 4 in calculating the share of cost amount. So let's do that in the next slide. Okay, share of cost. Step 4 is to deduct the maintenance need level or allowance amount. So since both Senor and Senora Garcia are applying, we're going to be subtracting 935 bucks. No, I'm sorry, 934 bucks. Okay, so we got the total here, right? That's the blue. We're deducting 934, that's here, because both spouses are applying for Medi-Cal. This is their share of cost for each spouse, which is a lot of money. So let's talk about it. If we did nothing, This is the share of cost for both Senor and Senora Garcia. Sheriff, and we're going to talk about how share of cost works. You don't pay the share of cost unless you want to use your Medi-Cal, or you don't have to pay the share of cost for IHSS unless you're using your IHSS. So we'll talk about that in a minute, but I want you all to understand this is how we got here in terms of the math. But this is some practical advice. Let's look at a practical tip. We're looking at the same numbers here. When I did the math, they're technically here. So this is the income limit for two people for free Medi-Cal. Free. They are just $14.50 over. It's not a lot, but it's technically still over. So the Medi-Cal office is still going to assign a really hefty share of cost, and rightfully so. But they're pretty close to the border. They're pretty close to the line of free Medi-Cal. It's only $14.50 that they're over for free Medi-Cal. Some practical advice. If the spouses purchase some sort of like supplemental plan, like it could be a dental plan, a vision plan, or even like if you're paying for a Part D plan that's a little bit more expensive, if they purchase a plan that is at least $14.50 per month in premiums, then they actually get to be eligible for free Medi-Cal. So you have to, the concept is spending a little to save a lot. Okay, so let's say, for example, Senora Garcia purchased a dental plan that actually costs 20 bucks per month. Okay, 20 bucks in premiums. If we do the math, this was her countable income. We subtract the 20 bucks from her dental plan. Now she's actually under income for here, right? Here's the limit for two people. She's technically under income by like a couple of dollars, like $2. I'm terrible at math. A couple of dollars, more than $2. Um, but she's right under the amount for free Medi-Cal at this point. So because she purchased $20, she's now able to get access to free Medi-Cal, which allows her to avoid a hefty share of cost that's actually 1,500 bucks per month. Um, Here's also kind of a tip too. You save, you spend $20 so that you can save $202.90. When you have free Medi-Cal, what we call full scope Medi-Cal, free Medi-Cal, Medi-Cal actually pays for the Medicare Part B premiums. So this amount no longer gets deducted from your Social Security check each month. It actually is being paid for by the state of California and by Medi-Cal. So again, think of it this way. Senora Garcia is spending 20 bucks per month in a dental plan so that she could actually save $202.90 plus get free Medi-Cal instead of a share of cost Medi-Cal. Plus she's avoiding a share of cost that's 1,500 bucks. Okay, I'm going to pause here because I know I've been talking for a while and a lot of math, and I'm not a math person, but I ran the numbers with my handy dandy calculator and the numbers are right. I'm happy to go over some of this again with y'all. But does anyone have questions about these steps, about the math, or if you want me to go back to a slide, I'm happy to do that at this time.
So when you say that the share of cost is 1,500 and change per spouse,
Per spouse. Yeah.
how does that make logical sense that their share of cost is greater than their combined income?
Well, no, their combined income is here.
Yeah, their combined income is $2,400 a month, and the share of cost is 1,500 times
Oh,
two, which is
um,
3,000.
so I don't include this because it's kind of getting the nitty-gritty of share of cost. Share of cost can apply to uh you could think of it kind of as family share of cost. So if, say, for example, Senora Garcia and Senor Garcia have like um medical expenses that add up to 1513, then one of them could get access to free Medi-Cal once they meet their share of cost. So it's kind of like a shared responsibility, but only one gets access to the share of cost. if that makes sense. There's going to be other slides that kind of go to that. But think of it as kind of like a shared responsibility, but technically only one person gets access to the free Medi-Cal services, at that point. Yeah. But you're right. If we're looking at it as Senora Garcia and Senor Garcia, 1,500 technically for each of them, for them to both access free Medi-Cal. Yes, it doesn't make sense. Welcome to the funny world of funny Medi-Cal math. Yeah. Um, just FYI, let me just turn back here. Sorry. This chart right here, this is the assumption of this hasn't been updated since the 1970s or 80s statutorily. Like California hasn't revisited this. We've tried to, but it didn't pass. This is how much California thinks Medi-Cal folks can live off of each month. If you are one person, you could live off of 600 bucks per month outside of, your medical
Okay,
expenses.
never mind. I was gonna say something.
Oh, these figures have not been updated since like the 70s or 80s, I believe. So this is terrible, but the law is currently set up where these are the amounts that Medi-Cal believes that folks can live off of each month. It doesn't take into account extremely high living costs, extremely high housing costs in California. Doesn't take into account the housing crisis, the food insecurity that we're experiencing here, the cost of eggs these days. None of that is unfortunately taken into account when determining these fixed amounts that haven't been updated for more than several decades. So you're preaching to the choir, Chip. I agree with you. It doesn't make any logical sense, but that's kind of currently legally how it works with Medi-Cal and share of cost. Why aren't they updating these numbers? We've tried. So this is when you can get involved. You and the folks that you are caregiving or the folks that you are assisting, or if you're from an organization, if you do any lobbying with your org, there have been prior legislative proposals to update these super stale, super outdated numbers, and they haven't gone through. Unfortunately, there have been several attempts. I think because of all the things that are going on federally, a lot of these efforts have been kind of put aside. But I still encourage my clients you have representatives at the state level who represent you, who have a say in Medi-Cal. Talk to them, write to them. Yeah.
Thank
Okay. Oh, I'm getting questions in here. I'm so sorry. Does this include your monthly Social Security income? Your Social Security income is always counted. Arisela. Okay, and let me see here. Just curious, how can Chip,
that was my question.
oh, okay, yeah. Yes, unfortunately. Arisela, yes, my dad gets over 1,800 and Social Security minus 20, minus the 35, and still not enough to get the share of costs removed. Oh, well, Arisela, if you're in Orange County, give us a call. It might be the math, because I don't know if 800 is exact, 1,800 is exact amounts. Like, you can be $1 over and Medi-Cal will still slap on that share of cost on you. So
Yeah, he gets I think it's 1,910. That's what he gets a month.
1,010?
Yeah, 1910.
Oh, 1,910.
Yeah.
Oh, I'm terrible at math. So minus 20, minus 35. I mean, he might soon, because the limit's going up. So it might change. Let me see, minus 20, minus 35. You're 1855. Technically, 1855 is more than 1801. So he's technically 54 bucks over.
So what
You
else could I include? What about like if he spends money on pharmaceuticals or stuff for his health? He has Alzheimer's
So
dementia.
that's different. That's meeting your share of costs versus actually trying to like reduce your countable income to get the free Medi-Cal. That's a different thing. Arisela, if you call, if you're an Orange County resident, if not, I'll include the Health Consumer Alliance number where you can call. You might want to wait until April 1, because April 1 is when the higher income limits go up, because it
Okay.
goes up each year with the federal poverty level.
Uh,
Dad might be actually eligible because he's so close to the line. Yeah.
Okay. I'll
Okay.
wait. Thank you so much. Yes, I'm in Anaheim.
Oh, okay. Arisa, give us a call. The number will be at the end of the presentation.
Okay,
Yeah, I
perfect.
can run the numbers for you and Dad. Okay. Amy, are there other kinds of expenses that would qualify to lower any insurance? So this includes like I don't know if y'all are familiar, but there's like cancer policies, and what's Medigap plans, or your Part D plans, dental plans, vision plans, any sort of health related insurance policies are deductible from your countable income. Um, Billed for current amount. Okay. Well, this is different. If you are living in a skilled nursing facility, there is something called a long-term care share of cost,
Uh,
and that is a different calculation. Today, we're just talking about share of costs for those who do not reside in a skilled nursing facility. Okay, Carrie, I answered your question, not satisfactorily, I'm sure, but um, this is just what the law is at this time. And if only the husband is interested in enrolling, he makes less than 1801. Wife's money still counts. They're still looking at wife and husband. But the calculations are slightly different. And if you are an Orange County resident, give us a call. But they do still count both spouses' income. Please confirm Social Security listed includes taxes. What does that mean? I'm sorry. Like, oh, because you've already, it'll be like it's usually just what your gross is minus your Part B premiums or any other premiums that you're paying for your Medicare, for your Social Security, Robin. Okay. Okay. Carrie, these are specific numbers. If you are an OC resident, I'm happy to do the math and see, what we can do. She's living in my home and I'm full-time caregiver. Okay. If you are not an OC resident, like I said, okay, yeah. These are numbers that I'm gonna have to break down and do the math for, so I'm happy to do that, but y'all are gonna have to call us to do a formal, open up a case for y'all. Okay. Any other questions? Thanks, Carrie. This is math. We're like going, sorry, I'm doing a math lesson in an afternoon on a Wednesday. But this is how it works with Medi-Cal. The sad part is when you go to the Medi-Cal office, the county workers, they don't do the math. They have the computer systems to automatically do it. But we as advocates, as attorneys, as paralegals, we're doing the manual math because sometimes the computer systems get it wrong or they're, counting things that they shouldn't. We're not going to go over long-term care share of cost today, Amy, because I could spend a whole hour on that. But you can call our office about it. And honestly, perhaps, Gabby, I can come back and do that. Maybe an
Of course.
extension of this. Yeah, let me write that down. Long-term care share of cost. Okay. Okay, let's kind of talk about how share of cost works. So, I'm a visual learner, so I'm going to provide kind of numbers and then I'm also going to provide visuals, okay? So hold on, here we go. Think of share of cost as the amount you pay before the Medi-Cal or the IHSS kicks in. So this is you, quote, meeting your share of costs. These are all like terms of art that Medi-Cal uses. This is what we call meeting your share of cost. Think of it as if you're kind of familiar with health insurance lingo, you don't have to be, but an easier concept to digest if you do is think of share cost as kind of like a deductible. But unfortunately, this deductible is terrible that it's monthly. But think of it as a monthly deductible. It's not a monthly premium, so you don't have to pay the share of cost unless you want to use your benefits. So it's not a guarantee that you're hit with this $1,500 per month no matter what. It's only if you ever need to use your Medi-Cal. So you pay it if you want to use your Medi-Cal. IHSS, you first pay the caregiver the share of cost amount, then IHSS in the state of California covers the rest. So we're going to show you an example of this. So after you meet or pay your share of cost, Then IHSS and Medi-Cal pays and covers everything else for the rest of the month. So think of it again, it's monthly. These are monthly share of cost amounts. So let's kind of look at these in an example. Let's look at a medical bill, okay? Let's talk about Mr. Park. Mr. Park has Medicare. All right, he has Medicare. He also has share of cost Medi-Cal, and unfortunately, a share of cost, let's say it's $1,500 per month. Let's say, for example, Mr. Park unfortunately had to undergo surgery, and the surgery bill was $100K, which is sadly in our crazy healthcare system isn't out of line. That's pretty pricey, but I wouldn't be surprised at a hospital bill this high. Medicare generally, this is original Medicare. It's different for Medicare Advantage plans, but let's just, for this example, we're generally saying Medicare covers 80%. So they're going to cover, say, for example, 80K of the 100K. Medi-Cal covers the remaining 20%, but Mr. Park has to first pay his share of cost. So the way that it works is, let's break down the numbers, 100K hospital bill. Medicare pays 80K, Mr. Park pays 1,500, and then Medi-Cal covers the rest. So essentially, instead of Mr. Park paying the full 20K, he's only paying 1,500. So this is how, in a scenario with like a medical billing, this is how share of cost works. Another way, basically the same information, but in a graph format. Again, Mr. Park's 100K surgery bill. If he just had Medicare, Medicare's covering the 80%. Mr. Park would have to pay the 20%, which would be the 20K. But if he has Medicare with a share of cost, Medicare's still only paying the 80%, but luckily he has share of cost Medi-Cal. He only has to pay 1,500 instead of paying the full amount. Sorry, this is red on red text. Okay. And instead, Medi-Cal covers the remaining 18,500. So again, instead of Mr. Park paying the full 20K, he's only paying 1,500. Is this helpful? I just created this a couple of days ago, and I thought, I'm trying to be visual. This helped me, but I hope it helps y'all. Share cost is a funky thing. Okay. Oh, I see a hand raise. Robin, go ahead. Oh, you're on mute. Oh, go ahead.
Yeah. So you're saying the 1,500, but that's that share of cost for 1 month.
For 1 month.
Yeah. So
It's not for the year. It's not like an annual deductible. It's a monthly deductible. Yeah.
right. So it's
So this is just for this bill that happened to occur in this month only. Once, the first of the month hits, it gets reset, unfortunately. Yeah.
yeah, okay, because that was going to be my point because he only pays 1,500, but he's actually going to be doing that all year round. So
Yeah, I mean, again, this is sometimes I call share of cost Medi-Cal just in case insurance because it's in a scenario where, Mr. Park would want to have the share of cost if he ever had a bill that's more than 1,500.
yeah.
So he's not going to be paying 1,500 every month. It's only when he needs a bill to be paid that's going to be more than 1,500. So I'm, again, knock on wood, Mr. Park, doesn't need surgery every month that's going to cost this much. But,
Mhm.
For some of my clients, like I said, I call it just in case backup
Yeah.
insurance. Yeah.
Insurance, yeah. So my other question is, you have Medicare, you have Medi-Cal.
Yeah.
Does Medi-Cal replace your supplemental?
So you're talking about Medigap. If you already have a Medigap plan and you apply for Medi-Cal, you technically can have both. But if you have Medi-Cal already and you're interested in purchasing a Medigap plan, it's illegal for insurance companies to sell you a supplemental Medigap plan if you already have Medi-Cal because for the most part, Medi-Cal and Medigap, what they do and the roles that they serve are the same. It's supplemental.
Mhm.
It's supplementing your already Medicare insurance. That's a complicated, if you want more information, Robin, about that and your specific situation, again, if you're an OC resident, give us a call. If not, the other legal aids can also provide you some guidance on how Medigap works with Medi-Cal and Medicare and all that jazz. Yeah.
Right, thanks.
Okay, cool. All right. Okay, let's look at IHSS because a lot of our clients are calling saying, hey, the only reason I'm applying for Medi-Cal is because I want IHSS, in-home supportive services. And so let's look at an IHSS share of cost example. Okay, so we're using Mr. Park again. Mr. Park has IHSS. He also still has that Medi-Cal share of cost, which is $1,500. Think of this as IHSS and Medi-Cal share of cost. Okay, it applies to both. So in this example, Mr. Park was awarded 100 IHSS hours, okay? IHSS did their home visit. Mr. Park had his doctor fill out the IHSS form saying that he needs in-home supportive services. And the county said, you know what, Mr. Park, we think you need lots of help at home and you get 100 hours per month in IHSS. Every county is different, and this is actually from 2025. I think it's gone up for 2026. But in Orange County, the IHSS caregiver pay rate is $18.50 an hour. So again, assuming this rate, I did the math, 100 hours times $18.50 an hour, that comes out to $18.50 as to how much Mr. Park incurs in his IHSS costs each month. So let's kind of look at it. This is his total IHSS cost. Mr. Park pays his caregiver the $1,500, his share of cost amount directly. So say, for example, his caregiver is his neighbor. And so Mr. Park pays his neighbor $1,500 per month. And then the remaining amount, which is $350 per month, the state or IHSS pays for the rest and pays the neighbor, the caregiver. So again, the same example, but in a chart format or a graph format I'll show you. So basically, with the share of cost, it's still worth it for Mr. Park to still have the share of cost because he's still saving $350 per month in IHSS costs. Even though he technically has to shell out the $1,500 himself, it's better than shelling out the full $1,850. He's only shelling out the $1,500. So again, same thing, same example, but in a graph form. Mr. Park's total IHSS cost for 100 hours per month is $18.50. If he didn't have a share of cost, with his share of cost, I'm sorry, with his share of cost, Mr. Park is technically paying this amount, but IHSS in the state is covering the $350. So he's saving $350 per month. Okay. Oh, I think we've reached the end. But any questions about how IHSS share of cost works? Oh, yeah, go ahead, Robin.
Okay, so when you say Mr. Park pays IHS share of costs, the $1,500, okay, I thought you said something about Mr. Park.
Here, I'll go back. This one?
Directly.
Oh, sorry, you cut out, Robin. Can you say that again?
Yes, the $1,500, that's the share of cost. That says here that Mr. Park pays his caregiver directly.
Yeah, the way that share of cost works is, because he has the share of cost, he's paying for that amount first. And then anything above that amount, that's when the state will say, okay, well, we'll cover the rest.
Yes, I get that because he's paying $1,500 a month share of costs. I think I was confused every month that $1,500 is always paid. It's not automatically taken out of something. It's like as a caregiver, that $1,500 a month, I'm always.
So it works a little different if you're like a family member. So say, for example, like you're like a spouse caregiver and you live with your spouse who is the IHSS recipient. unless you actually are paying your spouse the share of cost, you're not actually making that, payment to your spouse. It's just essentially you're not getting paid for the first 1,500, and then anything above the 1,500, IHSS and the state are covering. So it works a little differently for like family, because I don't know if family are actually in fact paying their share of costs to their family caregiver. But if this was like Mr. Park's neighbor, I'm sure he doesn't want to work for free. Technically, Mr. Park has to pay him the share of cost amount, and then anything above that amount, the state covers.
Okay.
So go ahead, Caroline.
I'm taking care of my husband and we have no share of costs.
Yeah,
And so IHSS is paying me. Is that,
that's
well,
case scenario.
they pay him to pay me, right?
Yeah.
So how does that count as income against share of cost and all that?
So if you are a spouse living with the person that you're caregiving, that income is exempt. It's not counted towards your husband's Medi-Cal countable income. It's as if your income is zero. And then there's specific rules for um, those who are not spouses who are living together. Yeah. But so your income that you're getting for caregiving your husband, if you live with your husband and you're married to your husband, that money is as if it's zero, according to Medi-Cal. Yeah. But that's great.
I have a question.
Yeah, go ahead, Alisa.
So I'm getting IHSS. My dad has a share of cost of 1,609. So does getting IHSS, does that help towards removing or reducing the share of cost for him?
So again, it depends on how many hours get allocated, because sometimes you're not allocated enough hours to cover the share of cost. So it's not even like financially worth it to have the share of cost for IHSS purposes, at least. It might be different for Medi-Cal. So you kind of have to do the math. And again, I'm happy to do the math and break it down. If you're an OC resident, give us a call. But in this example, Mr. Park had 100 hours. So his total cost happened to be more than what his share of cost was. So
Yeah, because he has I believe it's only 64 hours approved a month.
yeah, so I don't know if I have to do the math.
I'll
But I
call
don't know if it reaches that threshold. Yeah.
call you guys for sure.
Yes, please. And there might be ways. There's other programs. We didn't cover it today, but there's other programs that you may be eligible for if you are married, and there's something called spousal impoverishment. There may be a way to get rid of a share of cost depending on how much the spouses have. Yeah, so give us a call and we'll try to see if there's other programs, other free Medi-Cal programs to avoid the share of cost.
Okay, excellent. Thank you so much.
Yeah. Okay, this is the number to reach us. Again, this is for OC folks. I'm gonna put in the chat the number for, you know what? Yeah, let me put it in the chat here. Let me see it. Okay. Any questions while I'm finding out the number for the Health Consumer Alliance? And I'll put it in the chat for other counties outside of Orange County. Feel free to take yourself off mute. Outside
This
of...
is kind of in the weeds question, but we have some small income from investments.
Uh-huh.
I was told by a senior attorney that if we got our required minimum distribution as a chunk at the beginning of the year, it was not counted as income. If we got it in monthly payments, it was counted as income. Do you have any idea?
Yeah, give us a call, Caroline, because that's a very specific, yeah, there's
Okay.
specific rules on IRAs and 401ks, and it hits a lot of different legal issues, not only for income, but also for asset. And so, yeah, if you're in Orange County, give us a call and we could do the whole full assessment. But I think so far so good, right? Because unless this is something new that's been happening, I don't know if the county's aware of this new income. But give us a call. Give us a call.
Thank you.
Yeah. Betty Kim, where can I learn more about spousal caregiving program? I'm not sure if that's so as an IHSS recipient, you can have your spouse be your IHSS caregiver, your in-home supportive services caregiver. The IHSS, some of y'all could probably attest to this, requires live scanning, like fingerprinting, and then like an orientation. But yes, that's IHSS. I could give you information about IHSS.
We also have a recorded class from last year
Oh, we
that I
do,
can share
right?
the link to.
Okay, okay. Thank you, Gabby. I'm like, I think I've done it before. If not, I can come back and we can do another. We have a IHSS 101, like basics. Maybe I will add that to the list too. Maybe, yeah, we can revisit that later in the year. Okay. Okay. Patricia, you're asking about spousal impoverishment. If you are in Orange County and you're interested in spousal impoverishment, yes, give us a call. If you are outside of OC, please give the 888 number. Let me make sure I'm double, triple checking. 804-3536. Yeah. The 888 number is, let me just put this, see if I could respond to myself. This number is for the Health Consumer Alliance. You enter your zip code. It's like an automated menu. You enter your zip code and then it auto connects you to the legal aid that serves your county. Okay. Gabby, did I hit all
I think
the
so.
questions?
But yeah, if I took notes as well, so I'll make sure to send you guys the links to all the classes and the things that were mentioned in the email after the class.
Okay. Yeah. Okay. All right. Well, thank you everyone for your time and your energy. And thank you for the caregiving that you do. It's not an easy role to play. Gabby said it, you make sure you take some respite care for yourself. The oxygen mask metaphor, right? You can't take care of your loved one until you take care of yourself. So make sure you take care of yourself and each other. Okay. All right. Take care, everyone. Happy Wednesday. Bye-bye.
Thank you all. Bye.